It's not uncommon after you dislocate your shoulder once, it happens again a few months later. What do you do when it starts happening over and over? In this video, I answer the question of a viewer whose shoulder keeps dislocating as he continues to play sports. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of my Ask the Doctor video series based on questions you've left me in the comments to the videos on my channel. Shoulder dislocations have been shown over the years to have a very, depending on the study you read, wide discrepancy in how likely it is to become what we call a recurrent injury, meaning you dislocate your shoulder again and again. Some studies say that if you dislocate your shoulder once, maybe it's about a 25% chance of happening again. But some studies have that higher than 80%. So again, a wide range. Typically, some of what helps determine that is how old you are. The younger you are, typically, the more likely it's going to recur. If you have specific medical conditions, like a condition that causes your ligaments to be more lax or stretchy, so to speak, than other people, that might increase the risk. Or if there was other trauma in that initial injury that makes the shoulder more unstable. So there could be a variety of different reasons. But when somebody tells me, and this commenter left a question about how, and I don't remember if it was 4 or 5 times that it happened over a few years, typically the success of non-surgical treatment, putting it in a sling for 3 or 6 weeks, aggressive physical therapy. I'm a big fan of physical therapy, but those types of treatments, when it's become a recurrent shoulder dislocation, much less likely to work. A lot of times what's happened at that point, the labrum, the cartilage bumper along the socket has pulled off. The capsule, the envelope around the ball and socket has stretched out. Sometimes there's even bony indentation that makes it more likely for the ball to slide out of the socket. And a sling or physical therapy or both at that point, a lot of times make it very unlikely to prevent that recurrent dislocations. That's where surgery comes in. That's where a lot of times orthopedic surgeons and specifically orthopedic sports medicine specialists have gotten much more aggressive in younger athletes, even after a first-time shoulder dislocation, in getting an MRI or an MR arthrogram to look for structural damage in the shoulder right away and potentially even do a surgical stabilization of that shoulder even after the first dislocation. Now, if you have suffered an orthopedic injury and you want to hear about options other than cortisone shots, potentially options other than surgery, fill out the contact form. Click the link in the description below this video. It'll take you to a contact form on my website, and you can learn more about scheduling an appointment with me. I'd also love to hear about your experience with your injury. Leave those in the comments below this video. Just understand, if you do leave a question in the comments, I can't offer you medical advice, but what I can do sometimes is answer your question in a future video like I'm doing here. Make sure to subscribe to my channel, click the bell to be notified when I release a new video and when I start my new live streams, my monthly Ask Dr. Geier live shows. Thanks so much for watching. I look forward to helping you feel, look, and perform better than ever.